You're not going to have a bunch of hospital beds and ICU beds and all these supplies laying around in a hospital when you're trying to run a profit. All that shit costs money. So one of the prevailing COVID narratives lately has been that if you're not double vaccinated and triple masked and 45 booster shots and carrying around a vaccine passport, if you're not pro all of these things, not only are you a Trumper and you're a right winger, but also you have no compassion, you don't care for human beings, the hospitals are overwhelmed, there's not enough beds, how could you take this risk when there's not enough hospital beds, there's not enough beds, we don't have enough room in the hospital's overcrowded, this, that, the other. Do you know how many hospital beds there are in the United States? Do you know how many hospital beds there used to be in the United States? So currently, the US population is what? Currently, the US population, as of 2020, is almost 330 million people. 330 million people. Want to guess how many fucking hospital beds we have? About 900,000. Wow, that sounds like a small amount of beds for such a large country. Want to know what though? It's even worse than that, because we used to have more beds when we had less people. Does that make any sense to you? So in 1975, we had almost 1.5 million hospital beds in the United States. And in 1975, the population was what? 216 million people in 1975. Our population was 216 million people in 1975. And we had 1.5 million beds. Now our population is 330 million people, and we have under 1 million beds. So we've increased our population by over 100 million, and we've reduced our hospital beds by 1/3. Now, do you want to go blame a random person who doesn't have 14 boosters and 75 masks on, that they're the reason why hospitals are overcrowded? Or do you want to realize that we live in a for-profit healthcare system that has zero redundancies built in, that has no plan to deal with pandemics or outbreaks or major health emergencies? They can't even deal with the seasonal flu. The flu overwhelms our hospitals on a yearly basis. So it's all based on profit, okay? The reason why there's less beds, the reason why we have shitty healthcare outcomes, the reason why we spend more than anyone and we get less than anyone in the world is because it's a for-profit system and they are milking us for all we're worth. So please stop yelling at your neighbor because you think it's their fault that hospitals are overcrowded. You're an idiot if you're falling for that. You're an idiot. There's less than 1 million beds in a country of almost 350 million people, right? And we've been losing beds since 75. I mean, I remember this famous video in the very beginning of coronavirus of before it was bad here and we were all looking at videos of China of them building a hospital in like 2 days or some shit crazy. And it was like a video like, oh, it's scary over there, things are happening. And I was looking at that like, why don't we do shit like that here? They literally had a need and they filled that need immediately. They're like, oh, we don't have enough hospitals, we don't have enough beds, let's just build another hospital right now. There's a need, there's a problem, let's build it. What are we doing in our country? Nothing. They're just looking for think tanks to create propaganda so you yell at your neighbor while they reduce the amount of hospital beds so, you know, some investment firm can make money to steady, you know, the profit stream. So please stop fucking yelling at your neighbors, you idiots. You idiots. You know, focus your anger upwards. Stop punching sideways. Definitely don't punch down. You have to punch up. The owners and the rulers of this country are horrible people, and they're not making mistakes. This is on purpose. They're reducing the amount of beds while the population grows on purpose because that's making them money. It's that simple. You're not going to have a bunch of hospital beds and ICU beds and all these supplies laying around in a hospital when you're trying to run a profit. All that shit costs money. You're not going to hire extra doctors and nurses. No, you're going to work the ones you have to the bone. Please, guys, wake up. Wake up.